Hello, everyone. My name is Dr. Jacobs. I'm a doctor of physical therapy, and I'm the inventor of advanced soft tissue release, ASTR specialty. I'm also a cancer survivor, and I used to suffer from chronic migraines, headaches, pain, and fatigue before I invented ASTR specialty. All right, Mark, tell me what's going on with your feet.
I injured my foot hiking about 4 months ago, and it's been painful ever since. And I haven't been able to like hike or bike or even go for like long walks. It gets painful
So, which leg?
on the
Which
right one.
Okay. So, how much pain do you feel there from 0 to 10?
If I like move the toes back and forth,
Mm-hmm.
it's up there at like a 7 or an 8, real painful.
Mm-hmm.
The frontward hurts a lot,
Mhm.
and then if I go for a short bike ride, I get a lot of burning sensation. If
Okay.
I press like right in this area, it's a burning.
How much from 0 to 10 when you do that?
That'll get up to a 10 after like a bike or a hike.
Okay.
Yeah.
So we'll not be able to do the bike or the run or anything. So probably
Yeah.
we'll use that squeezing.
Yeah.
That. Do you feel it as soon as you stand or walk on it, or just take you a while to?
No, as soon as you stand.
Okay. How much as soon as you stand?
On just a regular day, as soon as I stand, it's more of like a 1 or a 2.
Mm-hmm.
Yeah.
And so that was 3 months, you said, or 4 months?
Beginning of May.
Beginning of May,
May,
we're in
June,
September, so it's
So 4 months.
4 months. So can you tell me what kind of treatment you had for your
Yeah, I've done
foot?
prolotherapy,
Okay.
PRP,
Mm-hmm.
chiropractic.
Is that from the injection here?
That's laser.
That's
that was
laser.
like a laser thing. The laser
Wow,
thing they
it's
did
burned?
both sides. Yeah, I think that one was just
Ooh.
the spot was held too long,
Oh yeah. Wow. Well, when
and that was like a month ago, and it still has that
you
little scar.
still have that. Wow. Okay. All right. So you had laser,
Laser,
PRP,
PRP,
chiropractor,
chiropractic,
prolotherapy,
prolo,
and
orthotics in the
orthotics.
shoes.
Okay.
Yeah,
Um,
X-rays.
X-rays, just
Just, yeah.
to check what's like if you have a fracture or something. Have any physical therapy or exercises or anything?
Yeah, I've done physical therapy and exercises. Lots of stretching that I just Googled myself and looked
Okay.
at different
So
various
you
things.
tried basically everything.
Yeah,
Okay. So make sure everything pain free. Okay.
yeah.
All right. So I will have you actually lie on your stomach, head over there. You feel pain going anywhere in the calf?
Not in the calf, I don't.
Okay. So make sure you tell me where's the spot. Is it here?
Yeah, a little bit closer to the toe, but right underneath the second toe.
Here.
Down a little bit.
Here. This the area.
Yeah.
Okay. Okay. Make sure this is not painful. How does that feel?
That's fine. That's like a 1.
Okay.
That's a 1 right there.
Okay. Let me check. Thank you. Okay. So I'm gonna actually work on here.
Yeah, that's tight right there.
Yeah, you feel that band here? Your plantar part?
Mm.
It's like it feels like a band here, and you have a scar tissue.
Yeah.
You feel that?
Yeah.
Okay, make sure it's not painful, okay?
And since then, I have that on both feet now.
Yeah. And that's the same spot there?
Yeah.
That band? Okay.
Yeah.
Yeah. So your pain aggravated with more activity,
Yes.
not the first few steps, yeah?
Correct.
Okay. Let me know if it's too much here, okay? How's that?
Tender.
Make sure it's not painful what I'm doing, yeah?
Yeah, no, it's not painful. When you mean just even like tender?
If you feel pressure, that's fine. If you feel like irritation, make sure you communicate with me.
Okay.
It's gonna feel cold, okay?
Yep.
I need to do a couple of things first here. So it's right in here, yeah. Is it painful?
No.
Okay. Sure. Okay. And you feel it right in here or in between here?
Underneath the toe.
Right in here.
Yeah.
Okay. Okay, you're gonna feel cold, okay?
Yep.
You feel that grinding?
Mm-hmm.
That's a scar tissue. It should feel like nice and smooth. Oh, that's a bad example. Yeah. Just take my word, okay? You don't have. Oh, like this. You feel that?
Okay, yeah.
Compare this to like. You feel that?
Yeah.
Okay, so that's like a little grain there. That's a lot of scar tissue here. And right in here, feel that? Okay. I can hear it. Can you hear it?
Mm-hmm.
Yeah. Can you hear it?
Yeah, I heard something, yeah.
Yeah. His feet is talking now.
Yeah.
Yeah. It's a lot of, and you can see it here. Look at the tool.
Uh-huh.
It's just jumping, and that. You see
Wow.
that? That's from the scar tissue.
Oh my goodness.
Yeah. So it feels like a little bit marble. I don't know. If you want to feel it, I can let you feel it. You know. You hold it here.
Hold
the tool. Right
hold
here.
the tool? Mm-hmm.
Hold it here. Just hold it
Oh yeah,
here.
yeah. Oh, you do it. Okay.
You feel that marble?
Yeah.
You feel that vibrating?
Yeah.
That's a scar tissue. Compare this to this. Feel how
Well,
nice
that's nothing,
smooth?
yeah.
Yeah,
That's
there's
nothing.
nothing here.
Wow.
And that's, so he has a lot of scar tissue here.
Wow.
Is that like built up over time?
Yeah,
Well, you
what?
said you hiked for 5 miles, yeah?
5 up,
On
5
that
down,
one.
so 10, yeah.
Oh, 10.
Yeah.
Oh, okay.
Yeah.
So, well, you have a bad anatomy to begin with. You put mileage on it. It's like your car out of alignment. You put more mileage, you wear it out more.
Mm-hmm.
You know? And you said like it was a steep incline and
Very.
Yeah.
Very, yeah.
So, so you start to have a micro tear there. When that happens, you start to build a scar tissue
Mm.
in that area. So, and that will decrease the range of motion, make it more tight, you know.
Mm.
So, that's probably what happened in your case. You have a scar tissue in here. Okay. Too much here?
No.
Okay. And you have a lot here, right? The spot you're talking about.
Mm.
Right
Here.
Yeah. And you will see also redness where he has a scar tissue here.
Yeah.
Yeah. big one here. Did your shoes was tight on you?
Not particularly. They're hiking shoes, trail running shoes.
Yeah.
They're
Which
not
ones?
wide at the base though.
Which ones were you
You,
wearing?
you really have a wide feet, so
Yeah.
make sure it's extra wide.
Yeah. It's
You know.
they were I think New Balance.
Because I said a
ones.
lot of times we use the New Balance, which does have the wider.
Yeah, yeah.
Yeah.
For you, I will not use any narrow shoes because that's risk factor. It's gonna smash your toes like this.
Yeah.
Yes, you're gonna have issue here
Yeah.
from the shoes itself.
Got it.
You know.
Yeah.
So like throw it away. Anything is tight.
Got it.
Yeah, you feel that here.
Mm-hmm.
Because when you start to build the scar tissue around the bone, it's calcification. So you start to have like bone spur. And that's easy can happen from tight shoes. Like, you know, especially for female, the high heeled shoes that's tight in the front. You see those patients that has their toes all totally in, which is supposed to be straight.
Yeah, you'll
From
see that
those-
with a little
Th-
bit.
those
Yeah.
shoes, I'm like, it's not look comfortable.
Why they wear this?
Okay, let me do this. Oops, oh wow, messed up my pants. Anyway, okay. It's Mark's fault. It's always patient faults.
Of course.
You hear that?
Mm-hmm.
It's right in his Achilles tendon. He has a little one like in the middle here. You feel this one?
Yeah.
Yeah, it's like a little bit, like a line like this
Wow.
of scar tissue. Yeah,
Oh,
yeah.
that's what that noise was? I thought it was
Yeah.
somebody knocking in the next room.
Yeah, this is. You hear it?
Yeah.
Yeah. Yeah, and you can see actually the line that I'm talking about is actually here. You'll see this line. Yeah, right in here. I want to get it in the camera.
Oh, that's okay. Yeah. Oh, yeah, yeah.
You
I
see
see what
this?
you're saying. Yeah, yeah.
Yeah, in here. That's what I feel it.
Huh.
Compared to everything else here, is not too bad actually. Okay, so let's actually sit up and squeeze your toe and tell me how's that, 0 to 10. How much it was before when we started?
Before it was like a 7 or 8.
7 or 8,
Yeah.
okay. What about now?
Definitely better, like a 1.
Where do you feel it now?
Kind of like right where the toe, if I bend it, it's kind of right where the toe's meeting the, but if I press down just a little bit right here is maybe a 1. So it
Oh,
would be kinda
right
like
in
where
that
the-
spot, I need to get there.
Yeah.
Okay. Alright, so it's more like kind of out the area that I work on. Okay, right in here.
Yeah. here.
Perfect, I get it.
Okay.
Right in the stomach, I got it. Now I'll have you stand up and just
Yeah.
put weight on it just to give me a feedback about the feeling. See, it's one in there. It's good. Okay. So it's right in here, yeah?
Yeah. And you move it around just a tiny bit too?
Yep.
Yeah. Yeah, right in there.
Yep. Okay. You feel this big one
Mhm.
here? Make sure that's not painful, okay?
That's a little tender.
Make sure you tell me, okay?
Okay.
And do not kick me, okay? I'm very close here. It's right in here, yeah?
Yeah.
Where you have that bump, yeah?
Yeah.
Is that what you're talking about?
Yeah.
Yeah.
Is that bump just scar?
That's a scar tissue.
Yeah.
That's right in here, yeah. Right, this one.
Yeah.
Is that too much?
No, that's fine.
Make sure it's not too much. It's right in here, yeah. That's a little scar tissue here. Okay. Okay, let's try it again.
That feels good.
0 to 10.
Maybe like a half of a 1.
Okay, not bad.
I'll take it.
How's that?
That feels good. That's like maybe a 1.
Where
Um,
do you feel it when you do that? Don't dislocate it. Yeah, really.
Yeah.
Okay. Don't do that in the camera, okay?
kind of on the. I think it's on the top that I'm feeling it.
Now you feel it on the top?
Yeah.
You change your mind? That's okay.
Yeah. It's no. Yeah.
It's lying in your back.
Okay. Come back in.
Yeah. We'll put this under this here. Okay. It's right in the top here.
Yeah.
Well, you had the burn.
A little. Yeah.
Okay.
That's the laser injury.
Yeah, that's. I can't believe it's still there. I need to give you like a headrest. Okay. Yeah. Yeah. Don't burn yourself, okay? It's right in here.
Yeah.
Okay. Right in here, yeah?
Yeah. Right there.
Painful?
A little tender right there.
Sorry.
Yeah.
My guess, actually, your shoes was tight
When during the hike, or just in general.
during the hike, or so because you were really squeezing on that.
Yeah.
That's my guess. Because the location of it, why this finger?
Yeah.
Why did so?
Yeah.
You know? Yeah, so
Yeah, and all the pads were like burning.
next time bring all your shoes here
Okay.
that you use, make sure it's not tight with you. Okay? Stand up. Actually sit up and try it again. How's that?
It feels good. Maybe it's still like a 1,
Mm-hmm.
kind of in the. I think it's more the bottom now.
Where?
Right there.
Right in here. Yep. Mm-hmm. Okay. Stomach. Relax. Got too much?
Mm-mm.
It's not bad, okay? You might have a little bit inflammation there.
Mm-hmm.
As long as it's not 6 or 7, that's okay. I just wanna make sure to release a couple of things and see if that's the cause or you have mild inflammation there. Okay? Let's try again. Let's try it again. Mhm.
That feels good.
Mhm.
If I press it down, I
Mhm.
definitely feel like on both sides
How much?
on the downward motion.
Mhm.
Could probably be maybe like a 2 or a 3.
Where? Where do you feel it in the...
Yeah. Like right there. More towards the inside of the, between the toes.
Right in here? Okay, right in the back. You feel it just in here, not on the bottom.
Let's see. If I squeeze hard, I can still feel a little bit on the bottom.
My concern is like that
The
burn
top.
that actually did not even heal. And I'm like 1 month, that's a very long time.
Yeah.
Everybody's not healing fast.
Yeah.
That's you definitely have inflammation there. Is it too much?
No.
Okay. You sure you tell me, okay?
Yeah, it's tender, but not too bad.
Okay. Okay, try it again.
I think I like that. It's still tender there. Just on the, not on the upward way
Try
though.
some more.
That way hurts a little bit if I go down. Maybe
0
like a
to
2 or
10?
3.
Where? In that spot.
Yeah.
But the original spot that you complain of, the one in the bottom.
The bottom one, I don't feel anything when I press down there.
Okay. So you don't feel pain. You just feel it on the top here.
On the top, yeah.
Right in here, yeah?
Yeah.
Okay, line it back. Relax. Push my hand. Push. And relax. Pull my hand. And relax. Okay. Push my hand here. Push. And relax. You feel it when you bring it up, or what's motion?
More of a pressing down motion.
Okay. Oops. You definitely hear that, yeah. Okay. All right, let's sit up again.
Better.
0 to 10.
A 1.
Not bad. I want you to stand up on any pain, discomfort?
Kind of when if I'm in this position, I
Mhm.
feel a little bit
0 to 10?
a 1.
Okay, 1 is not bad, okay.
Yeah, so it's only
Push off.
the push off. Yeah.
You have a little bit inflammation there. It's not too bad actually because it's 1, so
Yeah.
that's not too bad. Definitely I'll give you some tips for inflammation.
Okay.
Okay, you can sit down and tell me how this feels. How the treatment feels?
That feels good.
Yeah.
Yeah.
So what do you think? Well, you tried everything before, so can you tell any difference between ASTR and everything else?
I definitely feel like there's change there for sure.
Mm-hmm. So what kind of change?
Just when I was walking, it almost seems like the toes are more like separated, almost like the balance of
You
the
have
foot is-
more space in between.
Yeah.
It's not tight.
Yeah,
And you've been doing stretching before, yeah?
lots of different stretches.
Mm-hmm.
Yeah.
Okay. Awesome. Yeah, I'm glad you're feeling better.
Yeah.
Thank you.
Yeah, thanks.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.